Hi everyone, I'm Dr.M.Rajini, consultant gynecologist at MaxCure Suyosha Hospital, Madhapur. Today I'm going to speak about the topic A Guide to Antenatal Care. Pregnancy. Pregnancy is the most beautiful experience in any woman's life. Maybe it is first pregnancy, second pregnancy or third pregnancy. Every pregnancy is important for a woman. Not only for the woman, for the husband and also the family members. So, today, I want to guide you regarding the antenatal care, the routine antenatal care, what a woman should know. Pregnancy lasts for about 40 weeks. So, from the first day of the last menstrual period, we calculate the pregnancy according to the weeks. So, total 40 weeks. In 40 weeks pregnancy, we divide the pregnancy into 3 trimesters. First, second and third. First trimester, it lasts from first week of pregnancy to 12 weeks. And the second trimester from 13 weeks of pregnancy to 28 weeks. And the third trimester from 9 weeks to 40 weeks. So different trimester, there are a lot of changes in the woman's body. It is because of the hormonal changes. In the first, the missed period. Missed period is an indication that the woman is pregnant. Immediately after a missed period, you can do a urinary pregnancy test at home, or you can consult your gynecologist and get a pregnancy test in a nearby hospital. Antenatal care is also known as prenatal care. It is the care given to the pregnant woman during the pregnancy, throughout the course of pregnancy till she delivers. So after the missed period, when the patient is missing the period, she has to do a pregnancy test at home, or she can go to a gynecologist or nearby hospital. So after the pregnancy test is positive, then you need to go for an ultrasound scan at 5 to 6 weeks of pregnancy. At 5 to 6 weeks of pregnancy, a viability scan is done whether to see if the fetal heartbeat is seen or not, whether there is a live pregnancy or not. So immediately after consulting a doctor in the first visit, you need to give your proper history of your medical health issues and all. You need to tell the proper history about your menstrual cycles, whether they're regular or irregular. You need to give a proper obstetric history regarding the previous deliveries, any history of previous abortions, any history of previous stillbirths, or any other health issues during past pregnancies. Even if you are if it is your first pregnancy, you need to give a history about any previous miscarriages or anything like that. And medical history includes any history of hypertension, diabetes, asthma, or epilepsy. And you need to give a medical history of using any kind of medications. So once a viability scan is done at 6 weeks, that is ultrasound scan. Once a couple is planning for pregnancy, it is better for them to start folic acid medication even before planning the pregnancy. Taking folic acid, that is a vitamin tablet, minimum 3 months before pregnancy prevents development of any neural tube defects in the baby. So once a pregnancy, if not taken previously also, once the pregnancy is confirmed, immediately you need to start the folic acid medication, 400 micrograms per day. So that is the most important medication that you need to take in the first trimester of pregnancy. So some lifestyle modifications like stop drinking alcohol, avoid smoking and avoid caffeine, that is the most important things that you have to stop during the first trimester of pregnancy. After consulting the doctor, after ultrasound is done, then you need to go through some lab investigations like your blood grouping, typing, complete blood picture, complete urine examination, your thyroid levels, that is thyroid profile, and viral markers like are you having any previous infections like HIV, HPSAG, anti-HCV, all these things are to be done in the first trimester of pregnancy. So if you have any thyroid problem, if it is hyper or hypo, it may lead to some abnormalities in the baby and may affect your pregnancy thing. So you need to check all these investigations in the first trimester. And the routine care, in the sense dietary changes have to be done during pregnancy. That means because in the first trimester of pregnancy, first most common symptoms that patient face is nausea and vomiting. That is, vomiting is due to the pregnancy changes, hormonal changes. So any excessive amount of vomitings could be because of hyperthyroidism also. So simple lifestyle modifications like eating small regular meals and not taking heavy meals will definitely help for this morning sickness. And there are a lot of changes in the body also because of the hormonal changes. You may be feeling lazy, there may be a lot of mood swings, and your breast may have pain. There may be changes like you want to sleep more for more time and all. So these are the changes which happen in the first trimester because of the hormonal changes. And when coming to the 11 weeks, at 11 to 14 weeks of pregnancy, an ultrasound scan, NT scan should be done during pregnancy to know if the baby has any syndromes like Down syndrome and all. So that is the most important ultrasound scan that has to be done during pregnancy. Second trimester of pregnancy starts from 13 weeks to 28 weeks. So a lot of changes happen in the body because of the hormonal changes. There will be a change in the abdominal growth. The lower abdomen keeps on increasing. So because it has to accommodate the growing uterus, and your breast size increases, then there is pigmentation around the nipples, and there is change in the weight. Weight gain is there in the second trimester. So the most important things that have to be done in the second trimester is around 16 after 16 weeks is a quadruple marker test, and then from 18 weeks to 22 weeks the most important ultrasound scan, that is the TIFA scan, has to be done in the second trimester to see if there are any abnormalities in the baby. So better to actually the TIFA scan can be done up to 22 weeks, but it is better to get the scan done before 20 weeks. So other vaccinations which are important during pregnancy is the flu vaccine that has to be taken after 12 weeks. Till delivery you can take it, but ideal to take after 12 weeks. Then in the second trimester again we have to repeat your complete blood picture around 28 weeks to see if any anemia problem is there or not. And we need to see the GTT, that is glucose monitoring has to be done, so that if you are prone to GDM or something like that. So this is a crucial period. So you have to go for an ultrasound scan around 32 weeks where we look after the growth of the baby, that is known as a growth scan. The same things that happen during second trimester, they continue in the third trimester, like the weight gain, breast changes, abdomen grows more in size, and starting from 12 weeks onwards there is appearance of stretch marks also. So you can apply some amount of creams for the prevention of the stretch marks. So nearing term, that is after 36 weeks, anytime you can land in labor. So the frequency of antenatal visits are like in the first up to 28 weeks, you need to go for a regular checkup once in a month. And after 28 weeks, every 15 days up to 36 weeks. And after 36 weeks, you need to go weekly visits and visit your doctor. So in every antenatal visit, your doctor is going to check your weight gain, your BP, blood pressure, and the growth of the baby. So after 20 weeks, only you will be able to know the fetal movements also. So the fetal movements, perception of fetal movements is the most important thing. So whenever you're at home, as your doctor is not with you, so you can check your how the baby is moving inside. That is the movements. If you feel if there is any decreased amount of fetal movements, then it is you have to consult your doctor. Regarding the diet during pregnancy. Diet during pregnancy is the most important thing. So even if it is first, second or third trimester, try to take nutritious food which has a lot of vitamins, minerals in that. Avoid high sugar, high fatty foods, and eat more. Include more amount of fruits and vegetables in your diet, which have a lot of antioxidants. And try to keep yourself hydrated, drinking lots of water every day. Water, it can liquids, any kind of liquids, it can be in the form of coconut water, juices or soups is fine. So one most common complaint during pregnancy is constipation. Constipation can be avoided by having regular physical activity and taking lots of amounts of fluids. A lot of patients keep asking us, can they do exercise during pregnancy? Yes, they can do exercise in pregnancy, but at moderate intensity. If the pregnant lady has any other complications like heart disease, severe amount of heart disease, pulmonary diseases, or if they have undergone any cerclage or having a twin pregnancy or any other complications like placenta previa. In these conditions, it is better to avoid any kind of physical activity and better they take rest if they have these complications. And one more thing is swelling, body swelling and edema in the legs. It is common in pregnancy. So if there are some things that you can, which can help you, like avoid standing for a long time or sitting for a long time. And if you are working, then you can move around, and while sleeping you can put your foot and brace to avoid all these swellings. But any kind of excessive swellings or facial edema, you need to check with your gynecologist to see if there is any raise in the blood pressure. One more common complaint during pregnancy is acidity or heartburn. So for this thing is better to avoid spicy food or eating outside, and try to move around for a while after having food, and don't lie down immediately after taking food. And the most important medications that you need to take during pregnancy are the folic acid. As I already told you, folic acid is the most important tablet, that is a vitamin which has to be taken in the first trimester and can be continued till pregnancy. Iron and calcium supplements are the most important things that have to be taken during pregnancy. So usually we advise calcium and iron supplements after the first trimester, that is starting from the second trimester of the pregnancy, which will help in the development of baby. And other medications, whatever, if you have any other problems like cold, fever or flu, better you consult your gynecologist. Don't take any medicines on your own. Okay, regular visit, you are coming to your doctor monthly up to 28 weeks and 15 days from then. But when to consult your doctor in what is an emergency? How do you know it is an emergency? Any decreased fetal movements, if you are not able to appreciate the fetal movements, or if you feel the movements are less, then it is an emergency. You should consult your gynecologist. And if in the third trimester or second trimester, if you see some liquid is coming out from the vagina, then there is a need that you should consult your gynecologist. Any kind of abdominal pain which is increasing more in intensity, then you need to consult your gynecologist. In the third trimester, that is in the ending after 36 weeks, you have any of these symptoms like bleeding or draining or pain, then it is the time that you need to consult your gynecologist. This is the routine antenatal care which has been discussed by me now. So actually it made it very simple in your own language. So thank you for watching this video. If you have any queries or comments, please drop them in the comment box. We'll get back to you. Thank you.